Our video for today is about Leopold's maneuver, and this video is for educational purpose only. It's only done to accomplish the school requirement. Thank you. And before we start to do any intervention to the patient, we need to thoroughly clean our hands, as it is the most effective way to prevent the spread of germs and potential infections to patients, and ensure the privacy of the patient by closing any opened veil. Good morning, Ma'am Cruz. I am Roldan, your student nurse for today. I will check your bracelet here. Would you be able to state your full name for me? Thank you so much. Today, Ma'am Cruz, I will be performing Leopold's maneuver to determine the presentation and position of your baby, as well as I am going to monitor the fetal heart rate, heart tone of your uh, uh, baby. Would you like to go to the restroom first, Ma'am Cruz? Because it might be uncomfortable later during the palpation if you have full bladder. Ma'am Cruz, I will slightly lift both of your knees in here, and I will place a roll towel under one of your hip. And Ma'am Cruz, I will only be exposing the area to be assessed. Now perform the first maneuver, the fundal grip. It is to determine what part of the fetus is in the fundus. First, stand at the side of the bed facing the head part of the client using both hands. Palpate the upper abdomen by placing both palm on the either side. Locate for fetal parts found in the fundus. If the head is at the fundus, you will feel hard, round, and movable object. But if it is the buttocks, you will feel a soft and irregular shape mass that is difficult to move. Second maneuver, lateral or umbilical grip. It is to determine which side is the fetal back. First, put both hands on either side of the abdomen, applying gentle but deep pressure. It is to determine the fetal position. Then hold one side of the abdomen steady, palpate opposite side from top to the lower segment of the abdomen to feel fetal outline in a slightly circular motion. Small fetal parts feel modular with numerous angular modulation. Fetal back feels smooth, hard, like a resistant plane. Then repeat the same procedure on the opposite side. It is to identify fetal parts correctly. Third maneuver, the Pollex grip. It is to determine what part of your baby is in the lower abdomen. With the right hand using thumbs and finger, gently grasp the lower abdomen above the symphysis pubis. It determines engagement of presenting part. Press on lightly using thumb and finger and make a gentle movement from side to side. The presenting part is engaged if it is not movable. It is not yet engaged if it is still movable. If it is firm, it must be head. If it is soft, it could be breech. And lastly, identify correctly the presenting part. Fourth maneuver, pelvic grip. It is used to determine how far the fetus has descended in the pelvic inlet. Face the client foot part, place palm on the side of the abdomen just above the inguinal ligament. It determines degree of flexion of fetal head. Then grasp snugly the lower abdomen and with the outstretched thumbs meeting at the umbilical level. A small portion of fetal head can be palpated if it descends deeply. If cephalic prominence or brow of the baby is on the same side of the small fetal parts, the head is flexed. If cephalic prominence is on the same side of the fetal back, the head is extended. Identify correctly the degree of flexion,
Then
position,
lastly,
and
wash your
station
hands.
of the presenting part.
Liwat kita.
Now uncover the patient back and assist the client to go in a comfortable position. Then go wash thoroughly the hands again. Documents all findings, including the fetal position, the size, and her next visit again. Thank you for watching, and may God bless you.